As a little kid, I always feared going to the doctor like many kids do. I frequently also had to go to the dentist and orthodontist, and those were terrifying experiences for me. Eventually I overcame those and worked through it. But as I developed my desire for a career in the world, it was always science related, and I felt that I could provide a lot of help to patients who were struggling with the same struggles that I had as a young kid. Fortunately, I no longer have those to that degree, but it's still something that I'm reminded of, and that coming and seeing the doctor is not something that's easy for everybody to do. I chose gastroenterology for a couple of reasons. Within the internal medicine specialty, it's a subspecialty that lends itself to being both office-based as well as procedural-based. The combination of these two allows me to have a great interaction with patients on a frequent basis and allows me to use skills that may not be utilized in other professions. The chronic disease management is something that has affected my family, and specifically gastrointestinal disease, and I've seen how it can affect patients, and I think that it provides me with a little bit of perspective and some empathy in those situations. I received my undergrad education at the University of Texas at Austin, and subsequently went to the University of Texas at Houston for medical school, followed by internal medicine residency training in Colorado as well as fellowship in Colorado. As a kid growing up, my answer was I wanted to be either the garbage man, because I thought it would be fun to hang off the back of the truck and grab the garbage bags, or I thought I'd be really good at the grocery store being a sacker, putting the groceries in the right bag in the right order. Outside of the office, I spend a lot of time with my young family. My hobbies have changed with having kids, and hopefully we'll be able to enjoy some of those again in the future as the kids get older, but really enjoy skiing and biking. I have an iPhone charger and some earplugs and some chapstick that my son loves to go rub all over his face. In college, I was a vacuum cleaner repairman. My treatment philosophy is to accept that no two patients are alike, and that the same disease may have different impacts in different patients, and to figure out how each individual patient is going to be affected by their problem and how we're going to take care of it together.